Welcome back to Diabetes Files. I have no idea why this week has been off week. Maybe I just have to get acclimated back to the Eastern time zone, and it's Easter. And I know I went through a quick little episode about crucifixion, but we'll just go more into it because the crucifixion is the ultimate cinematic wound, in my opinion. Okay, so we're going to talk about one that doesn't compare at all, the one which is the crucifixion of Jesus Christ. So this isn't just about theology. We're just going to just deep dive into the wound of it, like the traumatics, the biomechanics, infectious disease, vascular collapse, and just for us to learn a little bit about crucifixion. And today's supposed to be the day he risen, right? So, crucifixion was perfected by the Roman Empire as a public, prolonged death designed to break the body and send a message. Pretty much did. And so today we're going to break it down clinically, like through medicine. So let's dive in a little bit of the history of the crucifixion. So, like I said, it wasn't invented by the Romans, but it was seems like it was perfected by the Romans. So, origins, I believe the Persians used it as an impalement style execution, and then the Carthaginians, I'm so sorry for pronouncing it wrong, adopted the suspension like death. And then the Romans refined it into this systematic torture. So what was the purpose of this, like crucifixion? Not just death, it was also a message of humiliation, correct? So victims were stripped, they were exposed, and they were on display publicly. So they usually reserved crucifixions for slaves, rebels, and non-citizens. And Roman citizens were almost never crucified because they found that type of execution was, in quotation marks, too degrading. So the crucifix wasn't always the classic shape, like the classic T, right? So there's types. There's actually three types, I believe. So there's crux, so CRUX, simplex, which is a single stake, like STAKE. Then there is the crux commissa, which is the T shape, right? Like a T. So the horizontal part is on the top, like a T shape, right? And then there's the crux immisma. So I'm going to just spell that IMMISSA. Sorry for the mispronunciation, but this is the one that is most associated with the Jesus of Nazareth crucifixion, which was the horizontal in between, like a small lowercase t, right? So the components of it was the horizontal beam, which was supposed to be carried by the victim, and the stipes. The stipes is the vertical beam, the one that is fixated in the ground. So let's strip away a little bit of the symbolism and look at this like we're clinicians and scientists. So why a cross shape? Like why did they choose this shape? The cross is not accidental. It actually creates a very specific physiological condition. So your arms are abducted, so away from your chest, abducted. The chest is expanded, okay? And the body is suspended. And with the body suspended, this position forces the body into a permanent inhalation. So the key factor is the body, its breathing is not just inhaling, it's exhaling. So if you can't exhale, you can't breathe. So it puts you in a permanent inhalation state. Okay. And you're trying to exhale because we're supposed to inhale and exhale. So remember in the last episode, I talked about through crucifixion, the person dies from asphyxiation. So let's break it down step by step. So when the arms are stretched out, your rib cage is expanded, and then the intercostal muscles are fixed, and then the diaphragm flattens. Now the body is hanging and being pulled down and locking the chest into place. Sounds so extremely painful. And the result of this is the inhalation is passive, but the exhalation, so to exhale, becomes active and difficult. And this is the critical scientific principle that breathing has become work dependent on the crucifix. Okay? So in the crucifixion, like to inhale is passive, to exhale is very different. It's like difficult and active. So it's like an engineered death cycle. Imagine it. The person is hanging, right? Because they're just hanging through the arms abducted, rib cage out here, right? And you suffocate, and then you push up to breathe, and you collapse, and then you suffocate again. So this is not just chaos. This is actually a feedback loop, a deadly one. So in each cycle, which causes an increase in carbon dioxide, CO2, which will result in respiratory acidosis. Then there will be a decrease in oxygen, which will cause what we call hypoxia. And then there will be muscle fatigue because, the person's on the crucifix. It's like you're suspended pretty much in the gravity, right? And muscle fatigue, your inability to push. And eventually, what would happen is your blood pH drops, the organs begin to fail, the heart becomes unstable, and the final outcome is cardiac arrest secondary to respiratory failure. So, we already talked about this in the last episode why they use the nails, the physics of suspension. So, why did they use nails? Why not rope, right? So, because nails do something that rope does, they fix the body in place. With ropes, the body can shift, the weight can be redistributed, survival time can vary. But with nails, the body is locked and fixed. The pressure points are fixated, right? Fixed. And the pain is quite constant because it's a nail through your hand, right? And your foot. And the load distribution science behind it, when nail is through your wrist, remember they said it's through your wrist, not your hand, forgive me. The force transfers through your ligaments, your bones, and your joint structures. And this prevents tearing. And the basic physics of this is force equals mass times gravity. And the Romans needed a structure that could support full body weight, overextend time, and then without failure. And that's pretty much what they achieved with the crucifix. So here's where it becomes deeply relevant. So the feet are not just injured, they're essential to staying alive. Okay. So every breath the person breathes, right? Every breath we breathe, we require plantar loading, force generation, forgive me, and upward propulsion. And think about this clinically. This is repeated by high pressure loading through a compromised structure. You're being on the scoops, your arms are abducted, right? Rib cage out, and with a penetrating trauma from the nails. And this would lead to ischemia, nerve damage, and structural breakdown. So, in modern wound care terms, this is forcing the person to have a fresh surgical wound because of the nails, right? Most likely also tetanus, under full body weight, repeatedly under failure. And this is exactly the opposite of offloading, in my opinion. So, why was the crucifix so effective? Why did this method last for centuries? Because it achieved four goals simultaneously: prolonged death, not just minutes, not just hours. Sometimes it even was prolonged through days, which is crazy. Maximum pain through nerve injury, muscle fatigue, ischemia, the public display, which is like humiliating as well as a warning to the public. The body becomes a warning. And then minimal resources. It was woods, nails, and manpower. So this made the crucifixion a escapable thing. Like it became terrifying. Now let's talk about the psychology behind it. Forgive me because I always get tongue tied. So the crucifixion isn't just physical trauma. It's also a psychological warfare. It's psychological trauma. So imagine seeing this: bodies hanging for days or hours, somebody's struggling to breathe, exposed to the elements. They don't care if it rains or shines. This creates fear, submission, as well as obedience. Rome didn't just control the land, they actually control the people, the general public's behavior. So let's talk about the scientific reality versus the myth. Let's just ground this in modern medicine. The myth was that the person died from the crucifixion through blood loss. No, the death via the crucifixion is from asphyxiation and respiratory acidosis. Okay. Next myth was it was a quick execution. Nope. Crucifixions are not quick. They're usually prolonged psychological collapse. Next myth, passive suffering. No, it was active, repeated struggle to breathe. So the person's actively struggling till the very, very, very end. Okay. So final reflection of this is where science meets humanity. The crucifixion is one of the earliest examples of like they actually applied biomechanics, physiological manipulation, as well as systemic trauma. And this is what they designed as death. And so when we look at the crucifixion of Jesus Christ, we're not just looking at history, we're looking at the limits of the human body, the consequences of engineered suffering, because that's what it was meant to do, and the intersection between medicine and meaning. So the clinical breakdowns of it, right? Another thing, the biomechanics with the suffering. Like I said, with the shoulders abducted, the elbows extended, and your thoracic cage locked in this inhalation state, you also have to remember that the isometric muscles are exhausted. They get exhausted, and then there's tetany from the acidosis, which is a progressive inability to breathe. So this is one of the earliest examples, recorded examples of positional asphyxia. And like I said, factors that can actually speed up the time of death, because like I said, death could last for hours or to even days. Factors that can affect the speed is the severity of the scurrying, remember the whipping, the blood loss, as well as the hydration status, because remember they put vinegar on his mouth, right? That's not hydrating at all. That's just even more suffering. And whether the legs were broken, because they breaking the legs caused immediate inability to push up, so that would even cause even more rapid death. And if somebody had survived long enough on the crucifix, because remember we said it could last up to days, open wounds, of course, more bacterial colonization, environment flies, contamination. The risk of sepsis is quite high, more tetanus-like infections. But most victims from a crucifix died before infection can fully develop. And this is diabetic foot flesh, so let's bring it back to diabetes. Could somebody have diabetes back then? Did diabetes exist in ancient time? Most likely, yes. Described by ancient physicians like Artius of Cappadocia. I'm so sorry if I mispronounced that, but the term diabetes means to pass through. So here's the difference in the prevalence. So it's much lower today. No processed sugar overload did they have, and they had more physical activity back then. So likely it would be type 1 or rare metabolic form. If type 2 existed, it would be very much less common. So the crucifixion plus diabetes, horrible outcome if that was the case. Most likely not, but we're just trying to incorporate diabetes in this. So you would expect the person to have poor healing, increased infection risk, faster progression to sepsis, and peripheral neuropathy. Like I said, it's a double-edged sword. The person would not feel the pain as much, especially if it's through tissue damage or like the nail through the wrist. But they wouldn't survive long because the crucifixion kills too fast when there are chronic complications that can dominate. And like we said with the foot, how important the foot is when it comes to them nailing through the foot, right? It would be direct trauma to the metatarsals and the tarsal structures. And the biomechanical load, the entire body weight, is nailed on the foot, and the repetitive push up. But remember, if they broke the legs, that's even worse. So you're creating a crush injury in the person's foot by doing the traumatic nail. You're causing a traumatic plantar ulcer pretty much, and you're causing vascular compromise and pretty much a acute compartment like stress symptom in the person's foot. But like I said, in the movies, they made it seem like it's a quick death. Most likely it wasn't, in my opinion. I'm not sure. But, the crucifixions are usually slow. Prolonged agony, cynical breathing attempts, full body systematic failure. So it's just, like I said, the person dies from slow suffocation. So with this being our Easter, episode. Crucifixion represents the intersection of medicine, history, and humanity. For whatever Easter means to anybody, I know what Easter means to me, but it's the ultimate example. It's our ultimate wound, right? It is very symbolic as well. It's the ultimate example of trauma, suffering, and as well as endurance. It causes a multi-system failure, and it's a story of resilience under extreme physiological stress. So, what can we take away from this? What does this teach us? Just to bring it more back to medicine and clinical, position matters, right? Because it was positional asphyxiation that killed this person, right? Killed Jesus of Nazareth on the crucifix. Posture can kill. That's why we offload when it comes to diabetic ulcers. Wounds are systemic, so trauma affects the whole body, not just the tissue. That's why I tell people that's why in medicine, podiatry, we learn the whole body because it's connected to the whole body and it has its systemic effects on the body. The foot actually does. Pain has a purpose. Okay. So the crucifixion, like I said, they made sure it was painful because it forced survival breathing. Okay. And then our famous words, time is tissue. Okay. They delayed it. They wanted to prolong it and cause suffering, unfortunately. So I hope people like this episode. It's just a deep dive more into the crucifixion, how it works. I mean, it's kind of I don't like really talking about it, but it's the ultimate cinematic wound. This is diabetic foot files. I hope everybody had a great Easter and take care of your feet because they take care of you.